this small and the intended format of question and answer, everyone is muted by default when they join this meeting, but everyone also has the permission and responsibility to unmute or mute themselves if there's background noise and distractions. We would love an engaging conversation, so feel free to unmute, chime in, ask questions. Feel free to type in the chat. We'll also do our best to monitor that between the regional center staff that we have participating, and we'll find opportune moments to pause and review things that have been typed in chat and respond to questions or read comments posted there. Continuing with a little bit of housekeeping, I'm going to share my screen. And what I'll be sharing with you is our internet website, our homepage that you can navigate to by searching for Alta Regional. Anywhere you navigate on our homepage, you can always get back to the homepage by clicking the icon at the top. Our logo takes you back to our homepage. This section here is going to remain static. This self-determination program you will always find in the same location on our website. And we're going to do our best to keep this current and up to date. And I promised Karen a April 1st update to this information. April Fool's Day. No, I did my best. She had some great suggestions, some very positive feedback ideas. It was previously introduced as a program that will be available. We know it's going to be available. It's currently available to some. I did change the tense of some of the verbs to make it appear as though we're actually living in the moment, but we're going to make this even better. We did update our Sdp Orientation link. Previously, if you clicked here, it said, reach out, shoot me an email, contact me, and I'll work with you to schedule your orientation. We've now got that posted online in our learning management system with instructions on how to navigate to that. We're going to make this front and center, or at least move this so it gets top billing. It's the headline's not buried. The orientation is an important first step in determining if this program is right for you. We want informed consent. So we're going to move this up. I haven't figured out how to do that yet, but I've got someone who's going to help me. Because you were all successful in joining today's meeting, we suspect you got a hold of this flyer at some point. Maybe your service coordinator sent it to you, and you clicked on the 5 o'clock link to join today's session on financial management services. We're going to do a repeat of financial management services because it's an important topic, interesting to everyone. So May 11th, we'll be doing that again. What you might not have figured out, maybe you have, maybe you've attended some previous sessions where you've heard me say this before, but I wouldn't consider it intuitive. When you click on the link on this flyer to register for one of these sessions, it's only going to register you for that specific session, April 13th, 5 p.m. If you want to attend the next session, you'll need to click the drop-down menu and select the next date that we're hosting a question and answer. We did that intentionally. We know we could have made it easier and allowed you to sign up for all 8 sessions all at once, but we are offering language translation. And we did have someone request Spanish language translation in the afternoon session. And we just don't have the ability to predict and plan for and invite translators of every possible language to attend every one of these sessions. So if folks indicate to us they have a language other than English, we'll figure that out from their registration and invite a translator to join us for whichever session they've said they want to participate in. That said, I'm going to go ahead now because I think time will permit, and I'm going to put a plug in, which I did earlier because we had available time on our intranet homepage. One of the things that's distracted me from spending as much time as I'd like on filling this with all sorts of valuable tools, resources, and information is our investment and commitment to making vaccinations available to the community. So this is my plug right here. We have on our website, I mentioned this section is static. You'll always be able to find self-determination information right here. This section of our website is where we plug in new and exciting things in the community, things that change periodically. Right now, a topic of great interest to everyone is availability and access to the COVID-19 vaccination. Right now, we've got a schedule of clinics that we've partnered with, including registration links for appointments. These are not limited or exclusive to regional center clients and family members. We advocated to have clients moved up in the tier of availability and eligibility for the vaccination. We were successful in that effort. Regional center clients, regardless of age, as long as they're over the age of 16, can sign up to receive a vaccination. Care providers of our clients, that would include family members that provide care and support, were eligible in an earlier tier. These links, once we make them public, are available to anyone who meets eligibility criteria for vaccinations. We probably have 500 doses from Safeway coming to these clinics. And if we don't fill the appointment slots, as we unfortunately were unable to do in Yuba City, we have to cancel those clinics and then notify the few number of people that signed up that there were insufficient appointments scheduled. So that's my plug for vaccines, which has nothing to do with budget planning for the self-determination program. I think I'll next introduce the folks from Alta who we have present, who are going to be sharing some information. And I say sharing some information, we don't want to be talking at you, but if you are interested in what we have to say, you're welcome to listen. Please interject if we say something that sparks a question. So I'll begin with Michelle Johnson, one of our 3 assistant directors of client services. We have Hannah Dunham, one of our client service managers in the Roseville office, one of our 3 client service managers in the Roseville office. Oh, actually we have 4. Sometimes I forget Jill Boxler because she works out of many other offices serving our early intervention 0 to 3-year-old kids. And Barbara Van Ingen, one of our service coordinators who works out of our Roseville office, who actually has some clients on our caseload who have successfully transitioned from traditional service delivery to the self-determination program. So she's got some firsthand experience from a case management perspective that also lends itself to information that clients and families might be interested in knowing and learning. So those are the folks we have here assembled today. And I'll go ahead and begin. We thought we'd start the topic, since we're talking about budget planning and putting together ultimately a spending plan for a client in the self-determination program, selecting the services that they want, that are important to them, that they've chosen, that they've identified. But where does that money come from? So I'm going to take this way, way back and talk about where regional centers get their funding from before they find its way into the valuable resources that support our clients to achieve the goals in their IPPs. So we are fortunate to have a robust funding from the state of California to the tune of $10 billion a year. That's the cost of the system for developmental disabilities in the state of California. That money comes to the state of California from both California tax dollars as well as some federal funding contribution. For many of our clients who are eligible for the Medicaid waiver, and you may have heard your service coordinator speak to you about the importance of that program. You may know if you're on that program or not. Service delivery should be somewhat transparent regardless, but the value and the benefit of being on the Medicaid waiver program is that the regional centers are able to draw down matching federal dollars for every Medicaid waiver billable purchase. That means if $3,000 are spent on a day program and you're on the Medicaid waiver program, the state of California is paying half of that, $1,500. We're able to get the feds to contribute $1,500 towards the cost of that. it helps make our system whole. That $10 billion, about a third or more of that comes to us from that federal participation. It's critically important. That said, when it comes to the governor signing the budget and regional centers or the developmental disability service system getting a $10 billion allocation to work with, the State Department of Developmental Services divvies that money up. They portion it out. They have some cost for their operations. It goes to headquarters. There's still some state institutions, state developmental centers that require funding out of that money to remain open and remain in operation. The bulk of that $10 billion goes to the 21 regional centers throughout the state of California, Alta being one of those, and our responsibility to serve our 25,000 clients in our 10 county catchment area. We end up with about $500 million, $500 million. That's a sizable budget. For those of you who participate in our POS meeting, you get to hear how those dollars are spent on different populations. But there is a portion that's carved out for operations. Regional centers do have some costs to operate. Business expenses for office space, which isn't getting as much use now as it did prior to COVID. And staff salaries, which are the bulk of our operations costs. And we do consider staff a resource to our clients. We employ 500 or more, actually, employees to support clients in achieving our vision, a community where individuals with developmental disabilities are valued members who are treated with dignity and respect. And every employee who works here at Alta should be finding their time and investment in what they do, working towards achieving that goal. I tell a little story about when John F. Kennedy visited NASA and bumped into a janitor mopping the floor and asked him what he did. And he said, "I'm helping to put a man on the moon." And I like to think that every single one of our employees, regardless of their job description, is working to achieve our vision. That said, the remaining 90% of that $500 million goes towards purchase of service, of direct service for our client population. That goes towards support for choices of preferred living arrangements, support for what people choose to do with their time during the day to be active and productive. And historically, those have all been accessed through the traditional service delivery model, which requires referral to a vendored regional center provider, a provider who's contracted with the regional center, has submitted a program design, has met Title 17 regulations for service delivery, has met quality assurance standards. The beauty of the self-determination program is you're no longer going to be limited or restricted to simply regional center vendored services. You get to pick and choose whoever you want, as long as they meet what would be the required standards to deliver the service, and it meets the SDP requirements for funding. But you're not limited simply to regional center vendors any longer. So with that, I'm going to turn the floor over to Michelle Johnson to either expand on that or introduce the next speaker. I'm going to peek in the chat too. Looks like we've got a comment from Sonia just pointing everybody's attention. She says we can visit the State Council's YouTube channel and see all the recordings of the previous 2 sessions we've covered. Thank you, Sonia.
All right, well, good evening, everybody. Thank you so much for taking time out of your evening to come and ask us questions about self-determination and budget and spending plans. So with regard to the budget, so every participant in self-determination will have an individual budget. And the budget is the total amount of money that you have to spend. Here at Alta, we have an internal process by where the service coordinator will send an email to Locke, and he was in our 5 o'clock set, or he was in our noon session. Is Locke on the line? Locke, are you here?
No, but I am, Michelle.
Okay,
Iqbal
Iqbal. Would you like to explain the process, or if not, I'm happy to just share it in a nutshell.
Sure. I'll just go over it. The DDS did create, based on the regulations surrounding SDP, did create a schedule for all regional centers to utilize, and we use that template, and it pretty much it grabs the past history of your expenditures that you were, if you're a brand new client converting over to SDP, it would grab your past 12-month history, and then we would take that and we would put them into these 3 buckets. And I forgot, Michelle, the 3 buckets names, but I think you guys will go over them. And we use your past 12-month history expenditure to develop a budget for the following year. And that budget needs to be signed off on by all parties, and that budget then becomes finalized for a 12-month period. And that 12-month period is not tied to a fiscal year. It could be any 12-month period. And that is the basis for your new spending plan. And that spending plan is also broken out on those 3 categories, I think community and independent living. And the budget is based off of the past 12-month history. However, if there are unmet needs or situations that may have changed, there's adjustments that can apply for them. And that's the nutshell. You could fill in the gaps, Michelle, I think.
Thank you, Iqbal. You did an awesome job. So there are 2 ways to change your budget, and one is an unmet need. An example of a unmet need is, let's say that the participant or the client was receiving respite. They got 40 hours of respite, but due to maybe the fact that the family lived kind of really far out, that they didn't have, the respite agency didn't have a provider maybe that could drive to the home, or there may have been workers that maybe didn't speak your particular language, and so that created a barrier to you receiving the service. So that is an example of an unmet need. Also, perhaps we had a participant or a client waiting to get into a particular maybe day program, and there was a waiting list. And so those are examples of where services have been discussed and maybe even agreed upon, maybe in your IPP, and because of barriers, you were not able to access that service. So as part of the IPP process, this whole self-determination process is a very collaborative process with the regional center, the participant, their IF if they choose to have one, their circle of support. But in looking at your budget, part of the discussion is going to be, were there unmet needs? Was there a change in circumstance? And an example of a change in circumstance would be that you were maybe you were in school, and now you're either 18 and you've got your diploma, or you're 22 and you've aged out, you got your certificate of completion, and now you're transitioning to the adult world. And so it could be day programs or community college or whatever, path or goal, dream that you have for yourself. And so your budget would not have day program in it or supports that are needed in the community because you were in school. So change of circumstance is now that you are finished with school, and you're now going to be looking at different services to meet your needs. And so the collaborative process is about, considering, looking at the budget that you have, and was there an unmet need? Was there a change in circumstance? And if there was, you would go through and talk about the particulars. Well, I had this respite, I had 40 hours, and I was only able to utilize 7 of the hours because of this barrier. And so the service coordinator, by planning team agreement, then will add those unused hours into your budget, and then they will send an email back to Locke, and he will reconfigure the budget. He will add in those services and send an email to the service coordinator saying, okay, here's your budget with all of the unmet need or the change in circumstance. Here's your budget. And so at that point, the participant, the client, circle of support would agree or look at the budget and then certify the budget that these are, this is the budget, these are the services that she needs. And at this time, I'm going to ask Hannah, who is one of our client service managers, and Barbara Van Ingen, who is one of our service coordinators. They have successfully transitioned 3 clients to SDP and are working on the 4th. And so they're going to talk to you about the perspectives and working with families through the budget and also with the spending plan.
Thank you, Michelle. So Michelle mentioned certifying the budget, and what that means is that all members of the planning team are in agreement with the budget, all unmet needs have been addressed, and it's been signed off on by the service coordinator and by the client services manager of the service coordinator. After that, after the budget's certified, the spending plan is developed, and as Iqbal mentioned, the 3 categories in that are health and safety, employment and community participation, and living arrangement. So the spending plan takes the budget funds and allocates them to those 3 areas based on how they're going to be spent for the next 12 months. And I will turn it over to Barbara, who has experience with this and can tell us more about the planning team's, the process the planning team goes through.
Thank you, Hannah. So for the spending plan, through person-centered planning, the SDP participant and their support team, they developed a spending plan, which identifies the cost of each service, activity, item, or support that they will purchase with their SDP budget. This includes the FMS, which is a requirement service for all SDP participants, as well as the IF, which is the independent facilitator, if the client chooses to utilize that service. It's not necessary, but the FMS is definitely a requirement for everyone in SDP. In addition to wages, cost for employee benefits, payroll, taxes, and insurance must be included when determining the cost of each service. The total spending plan cannot exceed the individual budget amount. The spending plan, once completed, will be reviewed by the service coordinator, the client services manager, and the FMS if they choose to be involved in that process. Some choose to be more involved than others. Others leave it more up to the planning team, the immediate planning team. Once it's approved by all parties, the service coordinator will then write the IPP, which outlines all the services that the client will be utilizing for the year, along with a breakdown of how much it will be spent on each service per year. There has been, due to COVID, a waiver for the cost of the FMS agency, but this has to be requested by the family. And this will allow participants to repurpose any of those waived fees for different and or additional SDP services during COVID-19. And I'm not sure how long that is going to last anymore. I know it's currently still an option, but I'm not sure how much longer DDS will approve that. So.
Thanks, Barbara. I haven't seen any questions pop up. Oh, wait, what were those 3 categories again? I'm going to share my screen because one of the handouts that was put together identifies those categories as well as subcategories that include service codes. So there are essentially 3 umbrellas that the funds get deposited into: the living arrangement, employment and community, and health and safety. And within those large sort of umbrella categories, there are subcategories that fit nicely within that description. And this handout also has definitions of those service categories defined. Good question. We'll make sure we get this resource posted on our website. It was part of the handout material when we did orientations live and in person. It may be part of the attachment in the LMS. I'll have to circle back and revisit to see if it's available there. So Tammy was able to remember health and safety, so she got one of the three and we covered the other two. Can I make that chart full page? Was that the chart I was just showing? Nancy, were you unable to see when I shared my screen?
Yeah, no, I was able to see it. It just went by really quick and I wanted to take a
Okay.
screenshot. I don't know if we can do that.
Nancy, I will email you not only the screenshot of the page that has the, if you want to put your email contact in the
Sure.
chat, and if you just want to share it specifically, exclusively with me, if you don't want it out to the group, I will email you not only, trying to find share my screen again, not only this page, which is page 24 of a 48-page resource handout of all things SDP related. It also includes the grid with the different service categories, the definitions of the service categories. I know the last page is the FMS fees. But I can email this 48-page resource to you.
That would be great. Thank you.
Absolutely.
Herman,
like
can
a
I add
copy
one other thing?
also.
Sorry. Can I add one other thing? This is Barbara. I just want to reiterate the importance of utilizing generic resources first, which include like Medi-Cal, IHSS, school, if you're still at school age, just because this allows you more money in your budget to spend on other items that may not necessarily be covered. So definitely utilizing generic resources is important.
Can I ask a question about that? I have a
Yep.
I have a school age teenager who is not utilizing services at school because we are homeschooling as a private homeschooling affidavit with a private homeschooling affidavit. So where does that put us?
Good question, Nancy. So what I think you're saying is you may not have access to some of the resources that you would traditionally have through a school because you're homeschooling.
Correct.
Okay. And so we would probably, so we haven't had a situation like that yet, but we would look at it on a case-by-case basis. And I'm saying that because, like, is there an IEP? Is there any services like that that might be able to be funded through the school? But, you know, if the DDS has said, if the services are not available, then you would be able to utilize your budget. And so how that works is the regional center doesn't traditionally funds, let's just say school-related services, whatever your specific service might be. And so we could not increase your budget for that purpose, but you have the funds in your budget. You could utilize or, you know, dedicate or delegate some of those funds to pay for the service that is not available through the generic resource. Does that make sense?
Yeah, I mean, it sounds like there will probably have to be some discussion about that with the service coordinator or something, but
Yeah.
It, you know, generally it makes sense.
Okay.
Thanks.
It's a good question.
Thank you.
And all I had said earlier was I'd love a copy of that as well too, please.
Oh, a copy of the
Of the
I-
the chart
document,
that,
the
I'm
document.
okay.
I'm going through our chat and cutting and pasting people's email addresses and sending them out as we speak.
Awesome.
I have a question when if nobody else has one. I'm wondering about an instance, and I'm just making this up, but suppose you're using a vendored service provider. Is it feasible to use that provider, but in a non-vendored capacity, and have a discussion with them about rates, since there's a level of QA and regional center documentation that might not be required under self-determination?
Yes. Yes, the answer to that is yes. As a self-directed participant, part of that freedom, flexibility, I mean, this is your budget. And so that's the beauty of SDP, is you get to direct your funds. And so you may choose to utilize vendored services for some things and non-vendored services for other, or you can use all, all vendored, non-vendored, it's your choice. So yes, you could utilize non-vendored services, friends, neighbors, folks in the community. That is the beauty of self-determination, is you choose who you want to support you.
So for a client that I have, he's actually utilizing 3 of our vendors, but they negotiate the rate that they agree to. So it's a little bit more flexible in terms of paying a little bit more for getting more quality services. So there is the part of negotiation on their part.
Yeah, that's what I was kind of after, was to highlight the possibility of more creativity, and if you've got a vendor that you like, but you maybe want them to provide an additional service that's not currently part of their vendorization, but they're not going to be providing all the QA and other stuff that they do with regional center. Is it possible to negotiate a non-vendored service with them? And I think you answered that question, but if you want to amplify on that, that'd be great.
Yeah, I know when we held our forum for training for staff, we invited a specific vendor who had familiarity in serving clients currently enrolled in self-determination program. The most common example was, rather than attending program 5 days a week, they modified the schedule and went 3 days a week, allowing them some freedom and flexibility to fill the other 2 days with other activities that were of interest and importance to them, and a rate commiserate with the days and hours of attendance was agreed upon.
Okay, that sounds good. I'm just envisioning that there's probably going to be a lot of back and forth in terms of figuring out what services you want, then what the vendor is willing to charge for that, and then figuring out what you can afford, and so could be a bit of work on the negotiation side. And can you clarify whether regional center service coordinators would get involved in that, or would that be an independent facilitator job?
I'm speaking from my experience. In every situation that I've had so far, I've had an independent facilitator be part of that process. And they've actually taken on the part of, facilitating that. I know that the client has the choice to choose their service coordinator as their independent facilitator too. I haven't been in that scenario yet. So I think it's different for every situation.
Yeah, and the degree and the extent that the service coordinator would be involved, ultimately, this is about personal choice, personal freedom, personal responsibility that accompanies that. So I don't know that the service coordinator would feel comfortable interjecting what they feel a appropriate rate would be in a negotiation securing employment. I will share my screen again because one of the additional tools added in that resource binder is a template of a service provider agreement that helps or could guide that conversation to make sure you're covering all of the important decisions and agreements in terms of schedule, right down to rate of pay. And we talked about that this morning. And Karen, as you described, sort of a back and forth in a negotiation. If you're looking to recruit quality, you may have to offer a higher pay scale than minimum wage, which might mean fewer hours than if you were able to bring someone on board at a lower rate. And that those are the types of issues and decisions that employers have to face. I don't know if the FMS gets involved at all with this process. And if there's an upper end on a cap and assurances that people aren't going to be taken advantage of and paying exorbitant rates. But it hopefully will be a supported endeavor with resources at the disposal of the client to secure the provider they want to work with.
Again, from my aspect, just with the FMS agencies that I've been involved with, they have not really wanted to be involved in that process. It's more when the spending plan is complete, they want to review it. And, you know, if they have any questions on that part, kind of negotiate on that, but not in the negotiations of rate or pay or anything like that.
Just making sure all the math adds up, probably.
Yes.
That they're not going to exceed their budget.
Yep.
Quick question for Michelle. I briefly stepped away when you were going over how to change your budget. First one being unmet need. What was the second one?
The second one was change in circumstance. And that an example of that would be you are transitioning, let's say out of high school and into a day program or community college or job. And so your budget would not have, funding for a day program in it because you were in school. And so that's an example of change in circumstance. And, we would have that collaborative discussion about hopes, dreams, and then try to identify a service that would be appropriate and then include that based upon your desire to attend, frequency, that kind of thing. We would then add that into your budget before it is certified.
So these are changes that can be made anytime during a year or before your next IPP. Since, like, let's say, for example, last year during COVID, some of us got increased respite hours, which would increase our budget, I would assume. So we're doing any types of examples on how other things could affect the budget mid-year that would require change other than a pandemic?
Yeah, we would be looking at, again, change in circumstance, unmet need, somebody who's ambulatory, falls down some steps and breaks their leg and now they need support, in-home support, things like that. So yeah, those would be, we would, when those events happen, we would come together, as a team and discuss, yeah.
Okay. And just one last thing, this determine the resource finder you referenced, where do we get that? Is that something emailed to us or?
I emailed it to about 6 people who put their email addresses
Oh, okay,
in the
that's what
chat.
everyone's
I'm
talking
happy.
about.
I'm happy to do
Okay.
that. We're certainly going to make it available on our website going forward. I
Okay,
think there was probably a hidden link in the LMS the SDP orientation that you participated in through the LMS, which, by the way, is part of housekeeping. I forgot to mention. On that flyer, there were instructions provided to encourage folks to attend and participate in that SDP orientation, which is a requirement by law in the
Right.
Lanterman Act. Welfare and Institutions Code says you shall receive an orientation if you participate in the self-determination program. It's about an hour and a half. Hopefully everyone was successfully able to complete that. I see heads shaking. Yes, that's a good sign. Want to make sure that I see a thumbs up icon. Thank you, Tammy.
Hello?
And within that LMS, I think there was a link to resources, but I'm not going to tell you to go back and log in and find that. If you give me your email, I'll send you a copy. We'll get it posted on our website when we can devote some time to enhancing that. Thank you, Margot.
Sonia posted in the chat another possible change in circumstance might be somebody who lives with their family and then decides that they want to move out independently and they now need, supports to live independently. So certainly that can occur. And again, the regional center would engage in conversation about budget. Yeah. Thank you, Sonia, for that example.
Did you guys talk about the budget and the 10% flexibility for the different buckets?
I'm not hearing Karen.
I heard her. I think Barbara had mentioned that there is the flexibility to redistribute
Can anybody
funds
hear me?
within those 3 categories.
Yeah,
Michelle,
so
we're hearing you.
there are 3 categories, like we said.
Hello?
We can hear you.
I think she can't hear us.
Okay.
I'll send her a chat.
Hello?
Okay, so basically between the 3 areas that were talked about, the living and community supports, health and safety, and employment and community support. I'm reciting this off the top of my head, so I might have said that the wrong way. Thank you. In each category, you are able to reallocate funds. So let's say subcode 330, and you want to do it in the same category still, like living arrangements, you can allocate 10% of the total funds in that area without having to have an IPP meeting or anything else. If it is more than 10% and you're changing it to a different area, then you have to have an IPP meeting, discuss the need for it. And if everyone is in agreement, then, that can be made, but an IPP addendum does need to be done for that.
Can you also talk about, say, camp? Suppose somebody has 24/7 SLS and they would like to use part of that budget to go to an out-of-home camp, once a year. Would that fall within the same general area, or is that a different category?
So unlike traditional services where we do not fund for camp or any kind of social or recreational kind of stuff, you have a little bit more flexibility with SDP in order to, let's say, you have to relate the camp to your disability and how it's going to alleviate any kind of pain you may be having, or how it's going to help mitigate any ill conditions that you may have, or how it's going to better your life in that aspect. So it has to relate to your disability and how it's going to either help you in some aspect, but you have to be able to relate it back to your disability.
Is it
So
true
there's a
that,
lot more. I'm sorry, go ahead.
is it true that the camp has to have inclusivity though for the able-bodied and disabled? You can't just specifically use a service that's for disabled only. Is that correct? The way I understand that?
Great question, Tammy. And that's a complicated, although it's going to be as simple as yes or no, it's going to be a conversation to get there, because any service that's purchased using funds through the SDP program have to be compliant with the CMS final rule, the Centers for Medicaid Medicare Services final rule. And I'm going to see if I can find if we've got the one-page handout on that in the resource finder that I sent out, because that's been, yeah, sure enough, right here. I'm going to share my screen again. And here we are on page 13 of that handout. Eventually, all services that regional centers buy, even in the traditional service, are going to have to be compliant with this home and community-based services final rule. SDP has that requirement right out of the gate. Everything that's purchased using SDP funds needs to comply with these federal rules. And these rules say that we need to be respectful and honor client choice. There does need to be, in particular settings, settings that are integrated. So a camp that's specifically exclusively designed for individuals with developmental disabilities doesn't commingle with typically developing individuals, non-disabled peers, could arguably be segregated. But integration is a term that is able to be discussed. If it's your choice to be in that setting, and you can make a case that you're exercising your choice, I think it's quite possible that a camp could be added. By the way, camp, if I just do a search for camp, the other thing in this handout is some case examples of hypothetical situations. A case for an individual by the name of Sophia. Let me do that again. Camp. Sophia wants to go to camp. Guess what? Sophia eventually gets camp as a goal in her IPP. She wants to go to summer camp, and it's actually funded under the category of respite services. That means Sophia must be living with family, because the camp is going to give her family a break at the cost of $2,000 rather than investing that money in traditional respite services. And this is Sophia's hypothetical example of her spending plan.
Thank you.
And Tammy, if you missed last week's session, which was specifically on home and community-based services, our subject matter expert at the Regional Center, Catherine Weston, provided some information on that. And I know Sonia has some of those trainings recorded on the State Council website, where Catherine goes into lengthy, detailed explanations of how a service can be examined and assessed to determine whether or not it fits within that final rule compliance.
Thank you.
Great.
Yeah, I just subscribed to their YouTube channel, so.
Awesome. All right.
Herman, I have a question to clarify. So if somebody is not living with their family and wouldn't be qualified for respite, let's say they live in their own apartment and get independent living skills assistance, would they then have to use some of their ILS hours in order to be able to attend camp? They still want to go to camp. There's still things that they can identify that they're going to benefit from and learn at camp. Is that they would have to move some of those other funds to pay for camp, or because they wouldn't otherwise be getting respite?
I'll unmute and share my screen again. So looking at the established categories of service, in Sophia's case, I guess it made sense to consider it respite. It was an easy leap, but for someone living on their own, and your question, I may have to ask you to repeat it, but moving funds around is one thing. You may, right at the onset, know that camp is part of your plan for the year, so it's initially built in. And employment and community is a broad category, with community integration supports, participant directed goods and services as a subcategory. Community integration supports, service code 331. Community integration. If your community is learning, if in order to access your community, you're going to benefit from the skills that you get from going and socializing in a camp, because those skills can then be generalized back at home in your home environment. Again, I think an argument could be made that camp might fit under this service category. Everything, though, is going to be individually tailored, and these definitions of services, I think, are intentionally somewhat vague. This one, community integration supports, probably leaving the most room for many things to fall within the definition of this service. Did that answer your question, Sonia?
Yeah, I mean, you have to get that helps me understand how it could be attributed and accounted for when you're using it, but you have to receive that money into your budget somehow. And so you're saying it could be part of, you could use some of your community integration supports funds for camp, as opposed to in Sophia's case where she used respite to pay for the camp. So an adult could use community integration supports. I would think it could also fall under health and safety areas in terms of, for some people, it seems like it could fall under health and safety goal, but you're not necessarily getting funds under health and safety. You could potentially spend it, if that makes sense.
And it's not as if you're trading in a set of traditional services for comparable or like self-determination selected services. Your traditional services are giving you a budget, a pot of money from which you can then pick and choose from whatever is then important to you among all of those service categories, as long as you're tying them to an IPP goal and objective that's important to you.
Thank you.
If that concept makes sense.
Just out of curiosity, the rollout's in June, from what I've heard. And I was curious, are clients able to hire an IF prior to that June date so that they can kind of get all their ducks in a row, if you will, before that June rollout date? Is that, does anybody know that?
The independent facilitator is technically not hired until you flip the switch over to SDP services. It's funded through SDP. And Michelle, correct me if I'm wrong, but PCP is something that the person-centered plan is something you can develop, like your person-centered plan, which will help you create your IPP and create your how you want to spend your budget, basically, because it identifies all your interests and your needs and everything like that. So we do front that money initially, correct, Michelle?
Yes, for the participants that are as part of that are in the initial rollout,
Okay.
Yes, the answer, we do have that. I want to go back to Tammy's question because I think part of her question is can she get a head start on her services? Obviously, she may intend to be in SDP, and so at this time, certainly, Tammy, you can start collaborating and connecting with people in the community and all that. But in order to pay for a service, you have to be in self-determination. And I just want to also share that we have asked the Department of Developmental Services for a start date. Is it June 7th? Is it July 1st? And they have not given that information to us yet. And so we are waiting for clarification from the Department of Developmental Services when folks can actually start. Like, what is the day people can start, utilizing or getting their budget and moving forward in the SDP process. So Tammy, did I answer your question related to? Can you sort of get a start on?
Yeah.
Okay.
And then I wanted to also kind of just make sure I understood Barbara's comment was that you can request a PCP prior to it going into the SDP. Is that?
So in the rollout session, I know we are able to fund for that.
Mhm.
I'm not sure once it rolls out to everybody, if that's still an option. Maybe Michelle or Herman could clarify that.
Yeah,
Well,
that's another question. Go ahead, Herman.
I was just going to say, we have questions out to the department for clarification on that. And as soon as we know, we'll certainly make it known to the public and advertised. The other piece, I just want to continue adding on to Tammy's question about the possibility of accessing an independent facilitator, when, how, payment. Just a reminder, the independent facilitator role does not have to be a paid position. To get someone who's a professional, you may have to pay a negotiated rate. But if you have someone who's a friend, known, trusted, someone who's willing to act on a volunteer basis in that capacity, independent facilitators can be unpaid volunteer positions in SDP. You could also ask your regional center service coordinator to act as your independent facilitator. Now, they are going to be somewhat limited. There's some capacity on what a service coordinator can do in that role. You can't just say, go find me 10 music teachers and then bring me the 3 best for me to choose from so I can build into my spending plan my goal to learn how to play music for a job. But they can certainly help with the person-centered planning, reviewing with you what's important to you, what's important for you, preparing to translate that person-centered plan into the IPP. The person-centered plan informs the IPP, and the person-centered plan is not a required document to have completed in order to move forward with self-determination program. So that's another piece. That was one of our first sessions we covered, was person-centered planning. And it's an important philosophy, but probably worth mentioning. The plan itself, the document, as valuable as it is and as much as it can help inform the IPP, is not a required component. The required component is the philosophy, the approach, keeping the client, the individual, the person being served at the center of the decision-making, and ensuring that their wishes are what's driving the planning. That's the person-centered approach versus the person-centered plan, all which ultimately ends up in the individual program plan that identifies the services that are being provided and paid for.
So technically, if I educate myself well enough between now and then, I might be able to just be my own IF then.
Absolutely.
Theoretically.
I wouldn't doubt it. I think that's an incredibly likely possibility. And in terms of education and resources, I'll point you to back to that resource handout. The last page were filled with hyperlinks to resources to gather other information related to person-centered planning. But one of the things we've discovered with independent facilitators popping up and kind of becoming more professional, they're people in Southern California who might promote themselves as an independent facilitator. They might be a great person-centered planner, and they might do a fabulous job of figuring out, Tammy, what you like, what's important to you and what's important for you, but they may not know the resources around where you live.
Right.
So to be a successful, skilled, independent facilitator, I think it's going to take a special person, someone with knowledge of the resources in the community.
Right. Okay.
This is Susan Halden, if I can interrupt. It's related to what you folks are talking about. I wonder, from the service coordinators who have rolled out self-determination for a couple of their clients, have any parents and or people who are the clients of Alta been their own independent facilitators? It seems like a very complex thing to me, and especially if you don't necessarily have people that you think you could staff various services with. I think you might need help, but I wonder if I'm looking at it in too complex a way.
In all the cases that I've done, this is Barbara, they have each chosen to hire a independent facilitator.
Our knowledge and what can be shared without breaching confidentiality, there are certainly clients who have used family members as their independent facilitator. That reminds me of another plug we can put forth, would be an invitation to participate in our local advisory committee, the Self-Determination Advisory Committee. The dates and links to join those meetings and participate in better understanding and planning of the eventual rollout are good discussions. Providers are invited to attend, staff are invited to attend, clients and family are invited to attend. And you can check that out on our website. You guys are probably tired of seeing me share my screen and take you to the self-determination site on our website. So I'll trust you can find it, and if not, reach out and ask, and I can fill you in. Okay, I see a wave goodbye. We are a little past the hour, which is fine for us. I'm not seeing any new questions in chat pop up. So unless anybody has anything, I'd encourage you, if you have interest, reach out to your service coordinator, advise them of your interest in going forward. Try to get your hands on as much information before the eventual rollout, and visit our website, and please come back for our next Q&A sessions.
Also, Disability DV United, Disability Voices United, they're doing a SDP conference this weekend. So if anybody goes to their website, I think it's $50 to join. So.
Thank you, Tammy. All right.
Thank you very much.